Welcome to the Community Spotlight Podcast. My guests today are Kimberly Keller and Erica Lasky from Legacy Health Systems of Bucyrus. Welcome back.
Thank you.
Thank you.
I hid myself behind the microphone like that because, it's probably the best view of me that you could see. Welcome here. It just seems like our relationship as far as being on this program is, it's like all of a sudden now it's been months.
Right.
What's happened to this time?
I don't know. It's just gone by so fast. Summer flew by, and, we're already into the Halloween, Oktoberfest, fall season. So.
Well, speaking of Oktoberfest and the fall season, you got quite a few activities coming up here in autumn time.
We do. We have on October the 25th, we have the Craft and Bake Sale at our facility at 1170 West Mansfield Street here in Bucyrus, a Legacy skilled nursing facility, and that is open to the public. A lot of the residents will be doing crafts for sale, and the employees will be making homemade items or store-bought, whatever they can do, and bring in to donate to them for sale. And all of the proceeds will go to activities. It'll go towards the activities. So when we have sales like that and we're doing fundraising, we're going for a big event. We just hosted the Columbus Zoo at our facility in September with the money that was raised all of last year. Yeah. It was $600 to actually have them come out and bring their animals and transport them. And so
there's a lot to these things that the public just doesn't know, that they just don't happen, do they?
Right. And these residents sold candy bars. They made crafts. They had bake sales. We had walking taco day. I mean, just to raise money so they could get the zoo to come in and
so the craft and the bake sales on October 25th.
Correct.
And I believe that's a Wednesday, if I'm not mistaken. And all the proceeds go to the activities department.
That is
which
correct.
Helps to provide better things for the folks that's there. Because, when you're in a facility, if you've been, it's like, I hate to say it, but sometimes it seems like every day is the same.
Right.
So anything new that comes along is exciting.
Yes.
So always remember that, folks.
The next event that we have coming on.
The next event that we've got coming up is on October 29th?
29th, yes.
Okay.
And that is trick-or-treating, and that is for the community as well, for friends and family to come. And it will be hosted from 2 to 4 at our facility as well. Residents will be handing out goodies to all the trick-or-treaters that are coming in.
And they are so excited to see the little ones come in their costumes. Yeah. They're so looking forward to it.
Well, most people, they like to see young people because they're used to seeing other elderly people. So
right.
I understand that. That makes a lot of sense.
Yeah.
So then you have the activity on October 31st?
Yes, that is, let me look this one up. That was a resident and staff Halloween party. I just wanted to announce that because, we do a lot in-house with our residents, and we are asking, that all of our employees bring a covered dish and, sweets and stuff like that. So we're actually having an actual Halloween party. We will dress up and then we'll vote for the best costumes and stuff like that. So some fun stuff going on.
So you got a lot of nice things there, especially towards the end of October. Mm-hmm. And you got a great event coming up. I believe it's on November 1st. I think that's a Wednesday, another Wednesday.
That is a Wednesday, yes.
And this has to do with the Alzheimer's Association. You're going to host an event there, correct?
That is correct. They will be hosting understanding and responding to dementia related behaviors, and that is for the community, that is for the staff, and that is for residents, loved ones that want to attend and help understand more about this diagnosis that their loved one has been diagnosed with. It is a quick onset disease, and sometimes it can last, longer than expected, but sometimes it can be a short term as well. So, but there's no recovery for it. There's just an understanding and learning how to deal with it, and that's what they're here for. They're very supportive.
And so it helps people to learn the dynamics of the disease,
Yes.
and how to navigate it.
Correct.
Is that pretty much where we would how we would say that?
Yes.
All right. Now, speaking of that, you opened a wing, didn't you? Here just recently, in
Yes.
the last few months.
August, yeah. So it's doing very well.
We have a secured memory care unit
Okay.
that we're able to offer secured care for those with a dementia diagnosis needing kind of that specialized care in a safe environment.
All right. And that's the major thing, a safe environment.
Yes.
Because, well, there's just a lot of things that can happen, and normally none of them good when people are not monitored
Right.
appropriately. Now, how many are in that wing now? I mean, how many beds are available in that wing?
We have a total of 16 beds.
Okay.
We have about 8 people currently, so we're about half full.
Okay, you're about half full. Now, are some of those, should I say, private, or I mean, maybe like a single in a room, and then some are more than?
Yes.
Okay, I thought.
Yep.
I don't. Sometimes I don't know the words. I can't get them out of my mouth.
Yes.
And, we do say private, but sometimes, depending on, their behavior, we may have to put them in a single bedroom. And then some people like the companions, so that's why we have dual occupancy beds as well.
Okay.
So,
Well, again, that's something that you have to have the proper diagnosis of it in order to treat this and to treat people in a respectful and loving way through this. And that's all impacts the family as well as the person who's being cared for.
that's right, yes.
And we've always got to do that. So always something new going on at Legacy. And again, I like to point out it's the former Heartland facility, because for some people that's not familiar where it is,
It's always been known as Heartland.
Heartland or Primedica, I believe is the name. Those were the former ones. But I always think of Heartland. Like I said, I remember the place when it was just a lot there.
Right.
So I'm really aging myself. But at any rate, this is a facility we're talking about, Legacy Bucyrus Skilled Nursing and Rehabilitation.
Correct. One last thing I wanted to share with the community is that we do open tours at our facility for our memory care unit and also for our regular wings in our facility. If anybody would like to come and do a tour, we always welcome that. We ask that you would call, but they are more than welcome to stop in. But they can call and reserve a tour. Or anybody at our facility is able to give a tour. Okay?
Well, it's kind of like the things that they someplace, walk-ins are welcome, but appointments are advised.
That's right.
Because you never know, yourself or Eric could both be very tied up with things, and then it just creates, it's better if you know something when you're coming in and respect everybody's time, when they come in, you know what I mean? Because everybody can get very busy.
Yes, and you never know what's going on.
No.
An event can be happening there, and they walk in and they think it's total chaos, and everybody.
It's just a special day.
Right.
Yes.
Something special's going on today.
Yeah,
so.
and sometimes things can get misinterpreted, can't they?
Yes,
Very
they
easily
can.
in a facility.
Yes.
Well, thank you again, both Eric Lasky and Kimberly Keller from Legacy Bucyrus Skilled Nursing Rehabilitation. Thanks for being guests today on the Community Podcast and Community Spotlight Podcast. And I thank you for coming over again. We look forward to having you back again, and especially here, it'll be New Year before we know it. And
Exactly.
we're already into October. So
Yeah.
thank you both for coming in and enlightening us. There's a lot going on out there. Again, this change took place in August, I believe, at the facility. So there's a lot's been happening in a short period of time, and I think a lot of good things going good directions. So check them out.
Yes.
Absolutely.
Thank you.
Thank you.
Thank you.